Well, I'd like to welcome you all here to our fifth annual Battle to Save Lives, which is our culminating event here in my class of Global Creating Impact in Global Health, Global and Public Health here at SMU. This is a senior capstone course, though not all of the students are seniors. Some of them are juniors and some of them are graduate students. And it is a course that I teach every year, and it really is focused on helping students create impact in global and public health, not in the future, but really right now. It really is about empowering young people to see that simple changes that they can make in their lives and in the lives of others can create significant change in the world. And I think that no time is the better to learn this and take this course than right here, right now, in our history, because things have changed so much. So I'd really like to sort of, welcome all of the students. We have some alumni as well. We have many family members. We are so happy to have you here. We have about 132 people here today, which though we are virtual, it's our largest one ever. So I'm happy because of that. But really welcome. We also have some people that I would like to just acknowledge as well. We have Dean Stephanie Knight, who is the Dean at the Simmons School of Education and Human Behavior. She's actually my dean. So Stephanie, you want to say a word or two to the families that have come?
Yes, I just want to say how thrilled I am to be able to participate in this really important competition, and I'm really looking forward to it. Welcome to the families also.
Perfect. Thank you so much, Stephanie. And also, we have a number of people who are also our judges, and I'll actually introduce them in a moment. But I just want to tell you a little bit about sort of how we began. Back in January 23rd, which is our first day of class, as you can recall, we began to have a report of a new disease that was picked up. It was first reported in the New York Times on the 21st. It's actually when the first case of coronavirus spread outside of the United States. And I remember reading this article and I thought to myself, this could be bad. And the very first homework assignment, as our students will remember, was actually about coronavirus. And we talked about what could what could China or the World Health Organization do to prevent a global spread of coronavirus. And the students came up with amazing ideas. Clearly, nobody listened to us because we have a global spread of coronavirus now. But really, over the next couple of weeks, we began to research this and understand this because it's rare that we have a global health pandemic that is affecting all of us that we can then study while we're taking a course in global and public health. This is one time where we did not have to go to the disease. The disease came to us, and so we began to learn. However, it wasn't really until the second week of March when we actually had our first case of coronavirus in Dallas County, right here, in Dallas proper. It began to be clear that this was going to impact us right here. And so by the 13th of March, at 2:30 in the afternoon, I remember it quite well, we got an announcement that we were going to have 2 weeks of spring break after we finish with spring break, as you will all remember it as well. It sort of took the students all by shock, because it wasn't clear if we were going to be able to finish the year at all. And one of the things that I did at that time, we had a big debate that day, as I'm sure the students will remember. We actually took this picture right here, which was all of us. And I did this really because I was concerned that we would not be able to come back together again. And so this was actually the very last time that we actually got together as a class. But I'm so happy that we actually did this, because it shows us really at a different point in our own evolution as a class and as a cohort, and really as a nation, as we began to understand how life was going to so radically change. When we came back, I decided, and online, I decided that we would throw ourselves into coronavirus rather than do other diseases. We were focused just on coronavirus. And as the students will remember, we did everything from how the virus replicates to mental health, to how it affects business, to how it affects the body, to innovative ways of treating it. We did every single thing that you could think about talking about coronavirus. We brought in people from the CDC who talked to us online. We brought in people from the London School of Hygiene who also talked about what they were doing in developing countries and in North Africa and the Middle East. We brought in medical students and physicians locally. We talked really about this in all the ways that we could possibly think of. And then about 2 weeks ago, the university, who has always been very forward-thinking in its approach to coronavirus, in its good judgment, as far as I'm concerned, decided that it was going to release a grant program for student teams to compete for innovative solutions to help the university open up in such a way that coronavirus would not be spread. And so we took it upon ourselves to make that our charge, that we would, as teams in this class, would come together and create innovative solutions to prevent coronavirus spread on campus, and that would be our case for the case competition. And that we, as 5 separate teams, would come up with innovative solutions and really compete for social good, compete to make change, compete to make a difference. And that's actually what you are going to be seeing tonight. Each of these 5 teams have come up with their own innovative solution. Each of them are very different, and they really build upon their strengths as a team. At the same time, some of them are also submitting their applications to SMU, to the granting program. And if they are successful, we'll win $5,000 to, over the next 90 days, implement the program that they have actually just designed, that you'll be hearing about today. So I'm very, very excited to introduce you to the students and to the student teams. And let me tell you a little bit about how things will go. We have 4 judges. We have Jennifer Altabeth, who is a community leader and a former attorney. She's a chair of the Dallas Theater Board, and is extremely connected and engaged with SMU. She graduated from the Medical School of Arts, as well as with a law degree from the Dedman School of Law. In addition, we have Dr. Majay, who is the Vice President of Student Affairs at SMU. And there he oversees the Office of the Dean for Student Life, Residential Life, and many other programs here, including the Bob Smith Health Center. We also have Dr. Peter Moore, who is the Provost ad interim and the Vice President for Academic Affairs. In this position, he oversees all academic programs at SMU. We also have Dr. Janelle Smith-Cullen, who's an assistant professor of civil and environmental engineering, where she focuses on sustainability and resilience, particularly in transportation. And then the final judge is actually you. All of the family members, all of you who are here today, will also be able to judge the competition as well. If you go to the chat section, you will actually see the criteria by which you should judge, as well as the program for today. And you can just download those. And as we go along, you can also be scoring the program, the student teams as well. And at the end, I'm going to ask you who you would vote for. But just as we begin, I wonder if you could just do me a favor. And as we start, let me know who you think right now who will win. Which team do you think has the best shot to win the battle to save lives? Give you about another 5 seconds. Great, I'm going to end polling. Can you see that? So what we see here is Team D has a whole lot of folks here. So teams A, B, C, and E, I'd call your folks up now and tell them to hop on. Because every single year has actually been the audience that has actually helped decide this battle to save lives. So tell your folks to come on, listen to what you have to share. Because what we really want is to educate everybody about coronavirus, educate everybody about what we're doing. The things that they hear today could save their life. And that's not hyperbole, because we are all battling this disease. So let your family and friends know about it so that they can not only support you, but that what they do, they hear today could possibly help save a life. So let me show you, I think I have it here. Oh, I do not. The order of the events is that we are going to begin first with Team A, who will present. They will present for about 12 minutes. Team A, please time yourself so that I don't have to cut you off. I don't like to do that, but I will. And then we're going to have about 10 to 15 minutes for questions from the judges. Then we will go to Team D with the same thing, 12 minutes to present, and then time for question and answers. We'll then take a 5-minute break in the middle, and then we will come back and hear from Team E, B, and C. Around 7:20, thereabouts, we will do the voting. So each of the people in the audience will register your vote at that point. And at that point, the judges will go back to deliberate. We will look at both what the judges' thoughts are and also what the audience's thoughts are. And we will calculate all of that and come back and let you know who is the champion of the battle to save lives.